Hello and welcome to the latest episode of Lovegrove on Health. My name is Dominic and joining me as always is Andrew Lovegrove, Senior Consultant at Skills for Health. How are things with you, Andrew?
Hi Dom, really good to be with you again. Things are going well at the moment. As we're recording today, we've got some lovely summer sunshine, which feels, given the winter we've had, we are definitely owed. So in a really good place today, and the summer sunshine just makes it even better.
Yeah, it's great to be back for a special episode, with a very special guest to talk about a special upcoming birthday for our NHS. But before we begin, we had a nice surprise in the last week or so with the latest update from FeedSpot. They essentially monitor all genre of podcasts and essentially those that are moving the needle or having some impact. And in the latest top 50 UK health podcasts that you must follow, we were there on the list.
Absolutely. We made the hit parade.
We did, yes. Number 40.
So we were a new entry. For those of you who are old enough to remember Top of the Pops, I think it was a new entry enters the charts at number 40. And given the fairly crowded space of podcasts, the world of podcasts, to enter that in our first year was a real bit of good news for us, and certainly gave me a lift. And to sort of build on that, I had some anecdotal experience of our impact. Recent holiday, I was sat in a restaurant on a cruise ship, and a couple came and sat down next to us, and one of them turned to me and said, "You have a podcast, don't you? I know you," which, for someone who's never craved celebrity status by any measure, had a few moments just sort of frozen on the spot, but then ended up having a really good conversation about the health sector and some of the challenges within the workforce. So even when I'm on holiday, I'm still flying the workforce development and health sector flag. I'm never off duty. So, it's been two good news stories that we've had over the last couple of weeks. And I think for it to tie in with the special anniversary that we're essentially focusing on today, it felt a very serendipitous and, indeed timely intervention, and for us to get those stats. So I think well done to everyone who's been involved with these podcasts. We've had several where it's just me and you, Dom, but we've had others where we've had special guest stars, and we've got some more podcasts in the pipeline following this one. So we hope people who are listening to this are enjoying it and are getting something from our conversations and deliberations.
So yeah, thank you to all those who subscribe, listen, share, review. We're very thankful for your ears, and we're glad that you're enjoying the content. And so to today's episode, we're delighted to welcome John Rogers, the Skills for Health Chief Executive. Welcome, John, and thanks for taking the time to join us in our little studio today.
Many thanks, Dom, and hi, Andrew. How are you doing?
Hi, John. Really great to have you with us today, and thank you for taking the time to join us. So today's podcast, we are reflecting on the anniversary of the NHS. So this July, the NHS celebrates its 75th anniversary, and we thought it would be really good as part of that, John, to have you join us today. But before we get into sort of like the conversation element of today, maybe for the benefit of our listeners, if you could perhaps say a little bit about yourself, and as Cilla Black would say, who you are and where'd you come from, and just a little bit about yourself, so our listeners can form a sort of an impression of you as we progress through today's session.
Yeah, thanks, Andrew. The simple answer of where I come from is Barnsley, but I'm sure that's not what you were really meaning. I've been Chief Executive at Skills for Health for the last 20 odd years, so a really long-serving Chief Executive. Set up Skills for Health in early 2000s, and obviously we've been on a long journey then. But all of my career has been within workforce development, In the days of old, if anybody can remember it, was operations director at the old NHS Training Authority, which was a special health authority. I also did my stint at Department of Health, but I've just absolutely loved my time at Skills for Health.
That's great, John. And, I think you've had a long and varied career within the health sector. And obviously for the last 20 so years with us here at Skills for Health. And I was reflecting on my own sort of journey, and I can remember when the NHS celebrated its 50th anniversary back in 1998. I was a second year student nurse training in Liverpool, and 50 years at that point seemed, such a long time. I was in my early 20s at that point, and we're here celebrating the 75th anniversary, and it's like half as much again since that time. And one of my reflections has been, 25 years ago, I was training to be a nurse, and that's what I saw my career being. Yet the breadth and depth of roles, opportunities within the health sector, effectively, I've arrived here as senior consultant at Skills for Health. You're here as the chief executive of Skills for Health. So I think it's testament to some of the opportunities. You're a boy from Barnsley. I'm a guy who grew up living in the northwest of England, and we're here working on a national level. So it just goes to show that there are opportunities, and anything is possible.
I mean, we all know it's such a great place to work, don't we? The main thing about these things is the people. And at the end of the day, I think everybody is values driven in terms of what we're all trying to achieve and work together on.
Absolutely. And I often say to people that even though I don't sort of practice clinically anymore, my thoughts are never too far away from the patient in the hospital bed or in the community, in the clinic, and I still see myself delivering care, but I'm just maybe one or two steps removed away from the bedside now. But everything that I do is about improving the outcomes for those individuals. I do that by trying to equip the workforce to provide the best possible care that it is able to do.
Yeah.
So I think, maybe, I mean, we'll come on to this a little bit later, but, we've both between us added up a fair few years working for Skills for Health. And I think that probably says something about our organisation and the values that sit behind it, and therefore the people it attracts who want to work and support the health sector.
Yeah, and I mean, it always feels a little bit glib in terms of vision and mission statements and things like that. But I mean, our mission statement is around improving lives through better skills and better jobs and delivering better services. And that's what we all live and breathe in terms of the organisation. And we find that people join this organisation because that's what they actually believe in. And therefore, we've got our own vocation in many ways in terms of people development, but it's in the service of delivering better services at the end of the day.
Absolutely. And I think, John, as we reflect on the NHS's 75th birthday, as you say, it can't be that long before we're celebrating our silver anniversary as well. So, an opportunity today, I think, to sort of look back and reflect. So if I can take you back to the early 2000s, a time where I had a bit more dark hair and a few less grey hair, put it that way. But I suppose the beginnings of Skills for Health, what was the gap back then, or the need for Skills for Health to come together, just to help our listeners understand why we came into existence? What were some of the drivers that brought our organisation to being as it is?
Oddly, in some ways, the establishment of Skills for Health came from the skills side of the world. So the government of the day was looking at how we better skill UK PLC. and was establishing sector skills councils across the economy. So they established 25 sector skills councils, everything from construction to engineering to finance to retail, you name it. And they wanted at that time to develop a sector skills council for health. And the old concept of sector skills councils, at that time at least, was to say what government wanted to do was to put employers in charge and in the lead on skills, and to actually give them the levers to actually drive the wider skills system in terms of education, training, colleges, etc. And that was why we were set up at the time. We were a little bit odd and peculiar, as they say, in terms of that pack, because if you were in engineering, it's obviously that you get the senior engineering companies together, etc., to actually drive that. And health already had quite a complicated landscape in terms of a range of bodies already involved in skills in health. So we ended up with quite a large sector skills council, and we had everybody from the professional bodies to the 4 departments of health, because we were UK wide, to employers, and all of the key stakeholders in terms of staff side, trade unions. And we had a council of about 28 individuals actually looking at skills across the piece.
And obviously, as the landscape around us has changed, we've obviously grown, changed shape to try and reflect that landscape. So as we celebrate the NHS's 75th anniversary, we are a different organisation, perhaps to the one when we first started. But I think I'd be right in saying, John, we've done that to try and reflect the landscape that we operate in, and to best serve those employers and those stakeholders that we work with, to try and really deliver on our key mission and vision statement.
I mean, the core purpose has never changed in terms of trying to deliver better skills, better jobs, better services, but we've done it in different ways as we've gone along. So in the early days, the niche part that the departments and employers wanted to drive on was what was then national competency frameworks, which didn't exist at the time. And so we were taking a national lead on driving national competence frameworks for cancer services, for mental health services, for you name it. And those competency frameworks were being used as drivers for all manner of support and interventions. And similarly, at the time, we started off hosting within an NHS trust. And as things have evolved, in 2012, we became a not-for-profit registered charity. But still very much at the heart of Skills for Health. We've still got NHS Trust chief executives on our board. We still have a very close relationship in recent years working with Health Education England. So I think we've always been a kind of a close cousin within the system as we've gone along, and still always felt part of that wider family.
Yeah. I often use the cousin analogy as well, John. That we're not explicitly part of, but we sit very closely alongside with. And I think that concept of partnership working has been key to some of our successes. And I know in the work that I do on a day-to-day basis, which is largely around frameworks, and the need for frameworks hasn't gone away. As we record, I've got 2 consultations out on 2 new frameworks, and I'm about to start a new piece of work on another framework. So the requirement for good workforce development interventions, initiatives such as frameworks hasn't gone away. We might call them slightly different things now. We may use different tools, techniques, but that's to reflect the changing landscape and the needs of the health sector, but I think, the need for those good workforce planning, workforce development interventions still seems as current as it was back in the early 2000s.
Absolutely, Andrew. And I mean, for example, like with apprenticeships, when we set off with apprenticeships in the early 2000s, they were in the hundreds per year. We were doing 700 apprenticeships a year. And Skills for Health took a real lead on that in the early 2000s, up until about 2012, again, when Health Education England came in. But even with that, between the early 2000s and 2012, we grew apprenticeships from the hundreds to doing about 12,000 apprenticeships a year at that stage. But we've just carried on with that in a different way with Health Education England, because Health Education England have been great partners within all of that work. And our team has worked with Health Education England hand in glove. And apprenticeships over recent years obviously have gone from strength to strength.
Absolutely. And I think it just, again, that's a really good example, John, of when we work together, when we work in partnership with those stakeholders, the better quality of the outputs and therefore the outcomes that we are able to then deliver on. And, I think we've got a lot to be proud of, particularly within that space. So thinking about Skills for Health, a potted history, John, you've mentioned apprenticeships, but are there any other kind of partnerships or initiatives that you are particularly proud of since Skills for Health was formed?
Probably within the time scope of this podcast, Andrew, probably too many. And therefore, I'll try to be kind of selective and please anybody listening to this. If we've done some fantastic work with you, which I hope we have, then we are time limited on this. But I mean, one of the brilliant ones was from about 2006 through to about 2009, 2010. And we were working with what were then the Workforce Development Confederations, which were regional based. And essentially, one of our drivers then, which it's still now, is how do we get better resource support for the wider healthcare workforce and, for the individuals who normally wouldn't be able to access training. And we got a fantastic scheme running in partnership with what was then learning and skills councils from the skills side of the world, because we straddled that really well at the time. And through those years, we were getting about 50 million a year from the Workforce Development Confederations, matched with 50 million a year from the learning and skills councils, and inputting that into training for that wider health workforce. And that was just absolutely terrific at the time. In many ways, that money didn't touch the size of Skills for Health as such, but we were at the heart of actually negotiating that and coordinating that and supporting that. And the number of individuals that benefited from that were just absolutely fantastic at the time. But again, it's another example of where partnership kind of can really drive things. You might ask a secondary question in terms of why did that stop? And it was really the financial crash at the time, because the stopping time was about 2009, 2010 was when government were going, we've got no money. But, it was absolutely fantastic for 3 or 4 years whilst it ran.
Yes, and I think that workforce, I have a particular, even though I was a registered practitioner in the health sector, I think we sometimes don't appreciate, I know we do at Skills for Health, but I think, more broadly, we don't always appreciate the work that the support workforce actually bring to delivering on those outcomes for patients. I remember a stat from many years ago, the workforce just below the level of a registered practitioner is 40% of the total health sector workforce, delivering nearly 60% of face-to-face direct care to people, populations, etc. Yet they don't necessarily always get the recognition that they I think deserve, and I know that's something we were keen to promote all elements of the workforce, but I know we have a particular soft spot for that workforce. And I think, one of the initiatives that I and we at Skills of Health are very proud of, and as we're recording this, it's only a few days since we had our 2023 Our Health Heroes. And I wasn't there this year, but obviously you were, John. And I think that is another great example of when we're able to shine a light on those heroes working within the health sector, and to give credit, yes, to those people as individuals, but also on behalf of everyone else who works tirelessly, improving outcomes and caring for people.
Yeah, and given that you weren't there, Andrew, I can say that the one day before yesterday, the QE2 conference centre was as good as ever. They are probably the most uplifting event of the year, because we've done this now for the last 7 years, and it really is saying thank you to those individuals who often don't get thanked enough. The people behind the scenes who actually make things work, and without which the NHS would literally fall apart. But you're really humbled at those events because we get thousands of submissions in terms of people being put up for awards. And the lovely thing about them is that they're put up by their colleagues and their peers, actually telling us how wonderful these individuals are in their day-to-day work and their day-to-day life. And the event itself, we normally get a celebrity to host. So we had Paul Sinner this year from The Chase, or Taskmaster, and stand-up comedian who did an absolutely fabulous job. And we normally get other VIPs in there as well. But just talking to the individuals, I'm not going to embarrass by names or anyone, but there was one lady who would set off from the north, and I'll not be specific, at 2:30 a.m. with her family to come to these awards. And it meant so much to them, but it also meant so much to us, because it is that opportunity to thank these people. And it's just a fantastic event.
Yes, and I did some of the shortlisting this year, and you really read the heartfeltness within some of those submissions, and what's almost between the lines as well. So I think that that award ceremony, that initiative we started, I can't believe it's 7 years, John. That's where does the time go? That's the shocking thing there. But I think it's been a great initiative, and I think something we collectively feel very proud of at Skills for Health, that we're able to sort of shine that light on the good that's done within the health sector.
Yeah, but it's one of those whereby, if you've done and I know you've done the judging, Andrew, for a number of years, as have I, and it's almost impossible to do the judging, because you're reading the applications and you're going, brilliant, brilliant, brilliant. And it's a classic at these awards where you say everybody is a winner. But in a sense, in this one, they actually really are.
Yeah.
Because just the fact that their colleagues have taken the time to put in the submission and say how wonderful these people are.
Yes. Yeah.
It's terrific.
I often think they're of course receiving the award for themselves, but I've often in my mind think they're actually receiving it on behalf of all the kind of the shortlisted people and all the submissions that we've had, because I remember being sat at my desk one day, and I had them sort of all over my desk, and I was like, I can't choose. I think I had to go out for a walk just to try and get some fresh air and some perspective. But I think it's something we're definitely very proud of.
Yeah.
So we've been here, John, as we said, for kind of the last 20, 21, 22, 23 years. What impression do you think our organisation has made, and either through feedback that you get formally, or even that kind of indirect, informal feedback. When you think about the last 20 odd years, what do you think our impact has been?
I think you can take it at the higher level. So I think if you take what we've been talking about in terms of competence frameworks, or if you talk about investments through workforce development confeds and learning skills councils, those type of things, the impact has been actually massive, but it's sometimes difficult to totally evaluate that. But then I think probably the individual conversations are as important. And I do genuinely get on a regular basis people dropping me the odd line or email saying staff member X had done such a fantastic job and they've been so great to work with, and that really I just felt bound to just drop you a line as the chief exec to say this individual has gone over and beyond. And I think what I like to think from what I talk to people is that I think people see us as an organisation with a high level of integrity, with good intent, and actually there for the benefit of the service. And I think hopefully that's what comes over to us as an organisation. And then, we've run individual schemes and academies, etc., and things of that nature. So there are a large number of people who have been individually touched and supported and developed by the direct work that we do. So I would genuinely like to think that we have had a big impact over that 20 odd years.
Absolutely, and I think, yes, you can look at things at the macro level and then look at things at the micro level, and certainly with the latter, I very often will have people, organisations approach me directly to say, look, could you have a conversation with us? We've got this problem. Is there something here that you might be able to help with? A lot of the times that answer is yes, sometimes it's no, but we'll always have that honest conversation with people. And one of a recent example I'll give, it's about a single framework that we developed back in 2016. We've had a stakeholder approach us to say, look, we like it, we enjoy using it, but it's starting to creak a little bit because practice has moved forward. However, we want to work with you again to update it and make it fit for the next generation of practitioners. So the fact that very often we're the go-to place for so many people and agencies, and we're seen as that trusted partner. I think you said the words high integrity, John, and I think that's absolutely hits the nail on the head. We whatever it is we do, we want to do it for the benefit of the public and others, and that's very much our raison d'etre, and all our solutions really kind of fall out of that, don't they?
Yeah, and there are some things whereby it's difficult to hit the nail on the head in terms of the benefits. So if you take something like the core skills training framework, which we developed back in 2012, and by 2018 we had about 80% of NHS trusts voluntarily signed up to that framework. And in some ways, it's slightly innocuous in terms of saying all of that standard core induction training, etc. But when you think about what went on before that, is that you had lots of trusts doing their own individual training, and there was an awful lot of waste in the system. Because if you went from Trust A to Trust B down the road, and there might only be 5 miles down the road or whatever, and you go through all of your induction core skills training again because it's slightly different where we are. And the amount of time, energy, effort that has actually been saved by that framework has been enormous. At one stage, somebody did an evaluation in London, and they were talking of tens of millions of pounds in terms of saved. And it's interesting that, we just see it as the core skills framework in terms of us trying to support the NHS, but actually the bottom line impact in that, and that's resources that can be put into other skills development, other services, etc. And it really is saving time and money. And of course, we've worked again more in partnership with NHS England on that in terms of how we fit that into the wider system in recent years as well. So all these things do have real impact.
They do. And having been pre the core skills training framework, working from one NHS organisation and moving, I think it was 7 miles up the road to a different trust, a different region within the NHS. And, as much as important information governance training is, having to do virtually the same module within about 6 weeks of doing the same one previously was no picnic. So very, again, absolutely, not dissing information governance. It is very important that people do that training, but not twice within a 6-week period when it's training. I would suggest. So,
as a practitioner at the time, you might have been spending your time better.
Absolutely. And I think it's the cumulative effect of that. That. Take me as an example. That was one person at one time in one organisation, but times that by, I always think of very junior doctors who spend time moving quite frequently from organisation to organisation. We know how challenging it is at the moment. Yes, they need to do their training. Yes, it needs to be to a high quality, but let's remove the waste, the repetition and duplication.
Yeah.
So talking about sort of looking more towards the future, John, I'd be really interested in your perspective on what challenges do you think lie ahead for the NHS in the immediate future? And I suppose, how do you see Skills for Health supporting some of these challenges?
Yeah, so that's getting the old crystal ball out, isn't it? In terms of,
at some point, John, it was bound to come at some point.
I'd probably pick a couple of things out. One is in terms of where we are with integrated care systems, but also where we are with integrated workforces. Because I think the one thing that we bring to the party is looking at how we take a wider view of care and how we look at the delivery of care and how you can actually flex skills to be able to do that. And I think that's one of the big areas of support that we can help with. I think then the other one, which is even harder to predict, is the impact of technology, because I think that we haven't even scratched the surface on that one at the moment, and all of the AI stuff in the news. And to a certain extent, people in health are kind of going, no, that won't impact us, because actually the reality is it will. And I think that, part of me is scared to death of AI in terms of its potential impact on society generally. But part of me is really, really excited in terms of how it can benefit our services and how we can do things better. And I guess it's a bit like social media or internet stuff, isn't it? That those things, if they are used for the good, have got real benefits for society. But we also see some really kind of negative things from social media and all of that. So I think the challenge is, how do we use AI and wider digital technology for the benefit of the service? But then the real challenge of that is the skills and the people, in terms of how we best integrate that, how we best change that, and how we use it for the good of the service rather than getting all the negative parts of it.
Yeah, and I remember many years ago doing a project in a hospital pharmacy, when the electronic stacking system came in, and it was basically it removed the need for a human to go and pick up the packet of tablets or what have you, and people were initially quite negative. Oh, we won't need technicians anymore. This is just a a workforce reduction exercise. And what we found was the net effect was not workforce reduction. It meant we could allow those pharmacy staff to work differently, to do the things that they were maximising them in the workplace by removing something that could be done by a machine, but it allowed them to focus their efforts and energies in other areas. And I'm not trying to conflate the two, but the way pharmacy services operate now, much more proactive, more medicines management work taking place, certainly in the community and in primary care. So maybe technology has allowed us to stop doing certain things to allow us to focus on doing other things that improve the patient experience and ultimately the outcomes for them.
And I think that is really where we need to head, because at the end of the day, within health and care, we have got infinite demand. We all know that we can invest as much percentage of our GDP, and we could always find better things to do. But what we also know is we've got finite resource, and that whatever the size of that finite resource will be, it will always be by definition finite. And therefore, I think the challenge with AI and technology is how we can actually use the resources that we've got better to actually provide that better patient care, that better services, etc. And as you say, Andrew, if we get it right, it's about freeing up other resource so that you can actually just improve those services across the piece. But I think it's really difficult at this point in time in terms of people truly predicting the direction of travel it will go. But I suspect that it will be an exponential development, because the way that AI is, it is exponential. And I think that we probably haven't got our heads around yet in terms of how it's really going to impact.
Absolutely. You're speaking to the guy who owned a computer for nearly a year and didn't realise there was a right click on the mouse. So I imagine my learning curve will be nothing short of vertical. But I suppose thinking about us now as an organisation, thinking about the future, what would you like to see Skills for Health do more of?
Yeah, interesting question. I think in terms of more of, it would be a better integration of everything that we do. So I think it's moving from actually looking at setting the frameworks, the standards, and all of that. It's then probably doing more in terms of delivery mechanisms and how we can support delivery mechanisms for those, and do some of the more kind of direct support, education, training bit. But then there is the part in terms of how we support organisation in terms of the whole integration agenda, and how that fits in with that. But then at the end of that part of it is how we accredit and how we recognise. So and within the organisation, we have got, as you know, components in all elements of that. And I think what I would like us to do more work on is actually joining that up better for the service, and actually giving them a seamless approach to all of that, so that we can go from one end of the spectrum to the other very seamlessly.
I think it reflects that the kind of the integration journey, both for the sector as a whole, for individual ICBs, for ourselves, is a never-ending journey, and that need to be the way we construct ourselves, the way we work with others, but work within our own sort of bodies is something that's an ongoing process. Some of it we'll get right, some of it we won't get so right. But I think something I've learned over the years, John, is nothing stays fixed as a statue. It's about constantly moving, constantly growing, constantly flexing to meet the needs that we find ourselves in at any given point.
Exactly, yeah.
So the last question topic, John, I would like to cover, this is a completely broad question now. This is not about skills for health. This is, but within the auspices of kind of those workforce development. What do you think we should be talking about in workforce development that we're not doing presently?
I'd probably wind back to part of our earlier conversation, because I think it is about taking that part of the workforce, the support workforce, who don't get enough investment in their development, education, training. And I think that's been an ongoing theme. And whilst we've had great successes in parts through the 20 odd years, I think you've still got 40% of the workforce who receive about 3% of the funding. And that's not saying in any stretch or imagination that we shouldn't be truly investing in the other part of the workforce. But I think we've always got to see people development as an investment rather than a cost. And that's always been a struggle as we've gone along. But it really is, we've got the forthcoming NHS workforce plan, which I've got great hopes for, but it's how you actually look at that in the context of the wider workforce and how we support that side of it. So I'd like us to be talking more about that side of it and how we actually do more in that area.
Yes, as you were speaking there, John, I think the key to the success of the workforce plan, we need to get the what right, obviously, but it's going to be in the how. And how do we realise its ambitions? And that it's not seen in splendid isolation. That we look at all the other broader drivers around our population and our workforce, and that it integrates into some of those other agendas as well.
Yes, and of course, Health Education England merging into NHS England is probably short-term difficulties, but actually there's a real opportunity there if we can get it right in terms of the wider service delivery part of it.
Absolutely. No workforce plan can be done in splendid isolation. I think someone once told me as a little soundbite, so I'll repeat that here again today. So, John, thank you so much for your time today. I've really enjoyed speaking with you and listening to what you've got to say, and hopefully our listeners have enjoyed this. So I'll say thank you, John. If you want to wrap up with any final words, this is your opportunity to do so.
No, thank you, Andrew. Thanks for the opportunity. And it was news to me at the start with Dom's introduction in terms of us being in the top 50 or 40 now. And I'm not surprised at that, because you deliver this with such a nice style, Andrew. And congratulations with all the work that you're doing on this.
Thank you very much, John. At that point, I'll hand back to Dom.
So all that's left for me to say is thank you very much for listening to this latest edition of Lovegrove on Health. A reminder that our podcast can be found on all the major platforms, including Spotify, Amazon, Apple and Google. And that's where you can also subscribe so you never miss an episode. You can also find the recordings on our Skills for Health website and social channels. Until next time, many thanks.
Bye.